there's two different aspects of quality that we have to look at when we look at a dental office. We have to look at both clinical quality and then we have to look at the business quality. Both dramatically have turned different.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management at the Naveen Jindal School of Management. Here at the University of Texas at Dallas, we bring together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare ecosystem. I'm Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management. Be sure to subscribe on Apple Podcasts, Spotify, or your favorite podcasting app to ensure you don't miss any of the future episodes. You can also join us online at businessofhealthcarepodcast.com. Today, we're going to address one of the most dynamic areas of business activity in healthcare, the dental industry. Our virtual destination is the Windy City, Chicago, to meet with Dr. A.J. Aceirno, CEO and owner of Decision One Dental Partners. Welcome to the Business of Healthcare, AJ.
Well, pleasure to be here. Glad to be here.
AJ, you have an established brand based upon a commitment to putting the soul back into healthcare. Let's start there. What's that all about?
You know, this goes back now to why I picked dentistry and what really brought me into dentistry. I was doing osteoporosis research as an undergraduate student at Creighton University and just looking at where medicine was going and looking at where I was like, man, I got to get out of this. I actually didn't know what I was going to do. My brother was in dental school and my brother was the one that said, listen, what do you like about healthcare? I told him. It was really the fact that, Mike, you know, I remember when our doc used to walk in, knew our family, knew everybody else's family, and actually felt good that they took care of us and we got better and then we moved forward. And I said, I just don't feel that that's what it is. I actually feel like in medicine, it's more of a shift worker. I don't want to do that. And he's like, well, wait a second, that's actually what dentistry does. That's when I jumped into dentistry. And quickly, I mean, in the first month of me coming out of school, I realized, whoa, there's a business component. It's like, this isn't just about drilling teeth. I actually have a business component. Not only is there a business component, but there's a bedside manner relationship-based component, right, that you have to deal with. So it's like this triangle approach. And I knew at that point, wait a second, business has to be a part of dentistry. I was able to correlate back to my medicine days, you know, and doing research of this is where they missed it. Business and healthcare weren't jiving together. They took the soul out of what really made medicine great, which is the relationship aspect. So how do we continue that relationship aspect in dentistry while continuing to build on business? Because let's get real. 1980, to run a dental practice, all you did was have to know how to manage a checkbook, to be honest. You know, just make sure that more money was coming in than was going out. 1990s, you kind of had to go, all right, I need to know a little bit. I actually have to take what was going in and out, put it on a piece of paper so I can see where it's all going, right? And in the 2000s, it then started to get, man, I gotta know a little bit about marketing. I have to know a little bit about this, but still manage it. Margins are still really good. We're okay. You know, recession hits, boom. Now all of a sudden, I actually need to know business. I have to have a little bit of a business eye to this. I got to start getting a team around me, all that. Now you really need an MBA in business. I mean, especially with what is occurring with inflation and other things that are on a horizon, the pandemic. Now you really need to be keen. The fact is that margins are at a position to where it can create a bankruptcy aspect in dentistry, which was really never even heard of. I mean, bankruptcy in dentistry was you really had to screw it up in order to do this. Now it's just a little bit different. So that's why I want to make sure that we keep the soul of dentistry, which is that relationship aspect. We're in somebody's mouth. We're next to somebody. We got to keep that. And how do we continue to build on business?
You're right. You know, I cannot think of a more intimate relationship from a medical perspective than opening your mouth and having someone go to work. That's certainly a trusted relationship and one that we all have always put a great deal of faith in. Growing up, the dentists were an important part of my life. And I still remember Dr. Robert and Ray Wirtz. They had a dental practice, and they're about a half mile from the house. And we would walk over there, and I had Dr. Robert Wirtz, and my brother had Dr. Raymond Wirtz. And those two brothers, they were a staple of the community, and everybody respected them. And if you were a half orphan without good coverage, they'd work with you on how we could, get paid appropriately, et cetera. So, yeah, things have changed a lot, and so is healthcare. And so what I'd like to do here, AJ, is first frame up a little background here as a benefit for our audience. We get the fact that there's more to a medical or dental practice than just the clinical side, and that's what we do at the University of Texas, Dallas. We have a program for physicians, the Alliance for Physician Leadership, where we bring dentists in and they learn a lot about emotional intelligence, and they learn a little bit about finance and cost management and strategy and negotiation. And we do the same. We have another program which is for healthcare professionals that include doctors and dentists and nurses, a wide variety of administrators, et cetera. But let's kind of frame up the size of this. So how many dentists are there now in the United States? There's quite a few, aren't there?
There is quite a few, and unfortunately, we've had a lot retire over the last 2 years, and we're coming into an issue where we're not going to have enough.
That's interesting. Because I thought we might have too many dentists right now.
I think the reality is that we only have 44% of this nation that actually goes to the dentist regularly. I'll give you a statistic that's it's a gut punch to our industry and really makes me kind of turn a little bit. Only out of that 44%, only 22% actually get their treatment done. So that'd be like if you ran a restaurant and 100 people came in, only 22 are sitting down for the main meal. It's an issue. It's a relationship-based issue. You just talking about emotional intelligence and self-awareness and being able to find a commonality with somebody and being able to sit down with them and have a conversation and listen to them and listen to their problems is an issue of why people don't get into treatment.
Well, that's interesting. So a couple 100,000 dentists out there, and dental schools, I saw a statistic said there's 6,500 people coming out of dental school right now. And most people may not realize what's involved with dental school. Kind of give a little quick background of how many years of practice preparation there is at dental school today.
4 years undergrad, 4 years graduate dental school. And then you could do a GPR if you want coming out of there. So call it 5 years post undergrad work that you're working with.
What's a GPR?
It's a general practice residency, so a residency program. So a year-long residency program that you can do. Some docs, prefer that. Most dental schools, are providing an opportunity for dentists to, as soon as they graduate, to be able to go into a workplace and start working right away. It's an interesting dynamic when you're talking about school. So I just want to say this real quick. In high school, you're fighting with yourself and you're working with yourself to get good grades in order to get to a good college. In college, you're working with yourself and you're fighting with yourself in order to get good grades in order to get into dental school. In dental school now, you're fighting with yourself and working with yourself in order to pass so you can become a dentist. And as soon as you graduate, somebody hands you the keys to say, now you're a leader of a bunch of people. That's a tough aspect when you just spent 8 years, 12 years of your life just fighting with yourself and working with yourself in order to get to where you need to be. Now we're asking them to be a leader of an organization, a leader of people, a leader of a business, when there's no business and there's no leadership characteristics that have been fostered during these years. So when we talk about school, I want to make sure that I think we are missing that aspect in the healthcare arena tremendously.
Yes, I agree. I've gone down to the local dental school here in Dallas, and I've done a lunch and learn and just talk about things that are non-clinical, like emotional intelligence, how to understand, your self-control and how to work with other people, et cetera. So my understanding, there's about 68 dental schools in the United States, and they graduate about 100 dentists every year. So about 6,800 dentists are coming out into the market. And the big question I have here, and this is going to kind of roll into some of the things that you've been doing professionally, but the big question I have here is, what does a new dentist coming out of school do? is there the opportunity for them to start their own practice, or are they going to basically have to go work for a larger organization? And the large organizations, the term we hear out in the general population is a DSO, a dental support organization. So what path do they have today? Is it narrowed down or is it broadening?
It's broadening. I think it's definitely broadening in the fact of what choices you have out there. When I graduated, I really had two choices. I either went and took over or became an associate of the dentist that I had as a kid, or went into a large group practice and moved into there. I picked the large group practice. Today, there are small groups, medium groups. There's single offices looking for associates. There's single offices looking to sell, all those things. The dentist is changing. Changing, whether it's good, bad, or indifferent, I think it's good, to be honest with you. But the dentist is changing on what they really want. When I graduated, 90% of us we were going to own our own practice and we're going out there and we're going to do that. Now the dentist is like, I don't know necessarily if I really want that. Plus I'm socked with $400,000 in debt. I mean, the average dental student is coming out with $330,000 in debt, and I think it's climbing.
Wow.
Okay, so you got $330,000 in debt and you're going to buy a $600,000 practice. You're $1 million in debt like that, right? So I'm concerned about that. Right. That's the part that I'm concerned about. We are graduating, which I think is good because I think women in healthcare is awesome. Their connection with people and their caring for the individuals is amazing. Not to say that on the male side that doesn't happen. I'm just saying on the female side it's really awesome. But we're graduating 66% of them, and a lot of women just don't want to own their own practice. Right. And males don't want to own their own practice. A lot of people just don't want to deal with the business aspect that's coming their way. That's okay. But that's where dental service organizations are becoming a big player in this. And that's really hence why my brother and I started a company and why we did this 10 years ago, understanding where the dental industry was headed. And now the question is, how can we continue to move that forward, not to lose the soul of healthcare, and create business aspects that can merge the two.
There are so many parallels right now between what you just described and what has been taking place in the physician-based healthcare industry as well. Today, Optum Care, they employ over 50,000 physicians. They have over 1,400 clinics, and they're going to add another 10,000 this year. And what are they doing? They're going out there and they're buying up independent practices. They're coordinating for a lot of good reasons. And it's a struggle for a lot of the physicians today to say, I'm going to maintain myself as an independent physician, a primary care physician, not a specialist. And because it's an attractive opportunity when you get 4 or 5 doctors together in a small practice, and then a large organization comes by and they say, look, we'd like to bring you in. And that kind of gets back to that quandary maybe of, what is the soul here that might be captured in that transaction? Are you going to be able to maintain the things that are important to you? And I know that back in 2007, the Institute for Health Improvement, they came up with this thing called the triple aim. And the triple aim basically said, look, let's try to improve, the population of patients' experience, the quality, the access, reliability, and, lower the cost, as we do that. And then in 2014, 7 years later, the quadruple aim came out and said, look, yeah, we want to do that, but we also want to make sure that the provider side, that the dentists and the doctors, that they are patient-centric and they don't burn out. I'm sure those are some of the concerns. When you bring people into a dental support organization or a dental service organization, what's the right term? Is it support or service, DSO?
Support. Dental support organization.
When you buy out a dental practice, how do you maintain that quality that this dentist has put into, or she's put into her practice over the last 3 decades and kept the lawn cut and the windows clean and the pride in that practice? How do you maintain that as you start to roll these things together?
There's 2 different aspects of quality that we have to look at when we look at a dental office. We have to look at both clinical quality and then we have to look at the business quality. Both dramatically have turned different. So let's just start with the clinical quality, okay? One of the aspects of dental support organizations is, oh man, it's just all they're looking for is volume and they don't care about quality and they move in. I actually would argue the opposite as a clinician myself. The opposite that I argue is this, is that if you're building a support organization, right, if you don't have good quality on your dentist, you're not going to be around for very long. The difference between a support organization is that you're amongst the support of your other colleagues. So you have your colleagues with you looking at your other work, as opposed to in your four walls of the old dental, school where you're just like, I built a shop and here I am. And by the way, no one's ever allowed into my four walls. And the way I do things is the way I do things. And actually, I think I'm doing things well because no one's ever told me that I'm not doing anything well, right? The only time you really figure it out is when somebody sues you. But nowadays, okay, that lawsuits are increasing. All of a sudden now that general dentist that was in their four walls is being exposed to that. And so I like the dental support organizations in regards to that aspect. I think we help increase and we set the bar a little bit higher on there. Now, that's different. I'll try to make this a short discussion. It's different because now we're telling dentists, colleagues, not business people, colleagues, dentists, are having conversations with other dentists about, wait a second, we're having too many remakes and crowns. Your fillings are falling out. Hey, this person. And so are they receptive of that? Are my other colleagues receptive of that? How does that look? When you're in your own four walls and they're like, man, I spent 20 years of my career and no one ever said anything to me. And now somebody's saying something to me could be offensive, right? So I think we're in that kind of quandary. Medicine went through the exact same thing, okay? Still continues to go through the exact same thing. I think on our front, it's very easy. You set up, for clinical, you set up an organization that just says, these are the things that are taught in dental school. Here is the benchmarks that are the best for dentists, understanding what those benchmarks are. And by the way, self-diagnose yourself. You know how to diagnose things. Self-diagnose yourself. If this isn't matching up in these areas, then look at yourself and say, okay, hey, we all fail. Failure is okay. How do I learn from that and how do I increase it? So that's on a clinical aspect. On a business aspect, when a dentist sells the practice to a general dentist or whatever, they say, give Mrs. Jones discounts, do this and do that. That's easy for a doc, by the way, that hasn't had a loan on the business for the last 15, 20 years, that has cash flowed really heavy during a time frame when margins were 44% and they didn't have to worry about any of this stuff. A little bit different today when insurances are trying to drive prices down, expenses are continuing to go up, and now we're sitting at margins of 15%, 14%, and we're going, wait a second, Mr. Jones, the doctor said that Mr. Jones should get a discount. How am I going to pay for that? Oh, wait a second, my supplies just went up. So business, we have to be secure in that the old days are the old days, just not here anymore. I love to give discounts to my patients, and I do. But the reality is that you have to be secure and understand your business before you can do a lot of these other things.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
I've been using the exact same dentist for 40 years. I moved to Dallas in 1979, and I found a really great dentist. She's been with me for 40 years, and she still owns her practice. She has a very small practice, very loyal group of followers, of course, and she's been suited to get bought out. And there's a lot of very popular dental support organizations that have billboards all over town and this, that, and the other. And I know some people I have some dentist friends that were bought out, and they're phasing out of the business. They have like a 2-year agreement to hang around so you don't lose all the revenue. But the experience now is well defined differently. You go to that same dental office and you don't see the same dentist. They have rotating dentists come in. And quite often you'll see, this is kind of a negative statement, but it's kind of like buying a car and they want to put new hood ornaments on it and, mud flaps and tinted windows. And you're in there seeing the dental and they've got numbers to make and they're suggesting that let's get this changed and that changed. And I think that's what you're trying to defend, AJ, is the soul of the practice, making sure that those things don't get taken away. Am I on the right topic here?
This is awesome. This is great. So let's talk about that real quick, okay? So in order to really figure this out, we have to know what is actually happening. When lifetime care is a topic when we talk about this, okay? So back in the days of dentistry in 1990s and early 2000s, a majority of dentists were, if it's not broke, don't fix it. Okay, so just keep on rolling with that. What did we see? We saw more people with partials, dentures, extractions, and so on. But the patient was like, it's okay. Hey, I'm older. I'm 70 years old. That means I should probably lose a tooth, right? Hey, this is my mother and father went through it, so therefore I'm going to go through it. The way we are taught in dental schools today is nobody should lose teeth. And if they do, there's an opportunity to replace teeth. And by the way, don't let it get to a position to where it's too far gone. Early diagnosis, early detection, lifetime care. That is created a mentality in offices when you switch over a dentist to say, hey, listen, my dentist every time he walks in says everything's great, everything's good. It's different mentality of dentists now where it's, wait a second, you have the start of periodontal disease. We're not going to wait till it's full-blown periodontal disease. We're going to actually correct it right now. You have a crack in your tooth. We're not going to wait till those things split and then you need to go ahead and have it extracted. We're going to try to fix it right now. And that is deemed to say, wait a second, they must be trying to sell me something or I'm doing something different. And it is an art to it. This is not science. There's a science part, but the art is being able to connect with patients and get them to understand and get to start treating patients how they want to be treated. To sit down with somebody and say, okay, here's the deal. The last 40 years, this is how you've been treated, Bob. Okay? There are a number of things that are going in your mouth that honestly, if it was my dad sitting there, I would not do. I'd want them to fix it. How do you want to move forward with your treatment? Because I'm okay if you don't want to move forward the way that I would like you to move forward. I'll be your dentist. Let's talk about this and let's figure it out, right? And a lot of them had supervised neglect, which is, I knew it was going on. I was just hoping that either I'm going to retire before it falls apart because I don't want to tell Bob that he's got a whole mouth full of bad dentistry or teeth that are going wrong. It's a different mentality of what it was and what it is now. And that can deem to be, wait a second, we have to do this. There is a funny thing. I just want to say one other thing is there's numbers to be made, right? What are the numbers to be made? Okay, I teach this way, and I will go to the end of my career continuing to teach this. More dentistry walks out your back door than walks in your front door. There's no numbers to be made. The number that needs to be made is you got to get more people into care, and you got to treat the people that are already coming in your door. More people say no because dentists don't know how to communicate with patients properly in order to get them to say yes. Yes to the stuff that you are. So that everybody thinks, oh my gosh, you're trying to find more stuff. Believe me, if we increased 5% of the treatment acceptance in this country, we would need to graduate about another 10,000 dentists a year in order to take care of all the work that needs to be done. Just concentrate on what's in front of you and how to get a patient and get them to connect with a patient. So numbers to be made. Everybody had numbers to be made. You think the dentist of 1980 didn't have numbers to be made? Oh, they did. It was when their checkbooks started to go low, you know what would happen? They would go into their office the next day and all of a sudden they had, instead of diagnosing 3 things, they diagnosed 10 things. The difference is it was the dentist they had forever and they had a relationship with them. So they're like, yeah, if you tell me jump off a building in order to do this filling, yeah, I'll go with you. Am I going to get hurt? You know, it's a different aspect to it. Today, we forget that relationship.
Yeah, it's just not drill 'em, bill 'em, and fill 'em, fill 'em and bill 'em, rather. And there's a parallelism here, once again, in the overall healthcare arena, in that the social determinants of healthcare, we have found out that 20 to 30% of your health is related to seeing a provider, a doctor. And the other has a lot to do with access and education and resources and things of that nature, which is the point that you just made, is that, you know, getting out and educating and making available, you know, good hygiene and good treatment is a key component of all that. So let me shift the question here a little bit, AJ. There's a lot of solo dentists still out there today, and they have the option of, I'm sure they're kind of feeling like they're fighting an uphill battle. There's competition in town. Maybe a small dental practice starts to come together with 5 or 6 dentists, and that solo dentist is up against that. And there might be a larger dental support organization that's trying to acquire different groups. Is there still a path? What do you see the future to be? Will most people end up in a dental support organization, or will there be some type of balanced approach there?
Gosh, I hope not. And that's coming from somebody that deals with dental, you know, is in the dental support organization world. I think there always needs to be private practice. There always needs to be small group. I love where we're at now, where there's just a plethora of opportunity for dentists, because every dentist is different. You know, some are like, hey, I don't want to work. They have an entrepreneurial spirit. Go buy your own. Go get it. Go after it, you know. So, no, I hope that doesn't happen, and I hope there continues to be the private practice world. I hope there continues to be the dental support organizations and small group practices. I just love it. I love it.
There's a couple more questions I want to make sure we cover with this discussion, and we won't be long on them, but how does insurance fit into the new changing world of dentistry? Is it pervasive? Is it steadied out? What's your view on that?
It's pervasive. I think it is the problem with access to care, to be honest with you. We have hooked everybody on the drug of, if my insurance doesn't pay for it, therefore I can't get treatment. And what they don't understand is that dentistry is still an affordable treatment for people to get good dental care, even if you don't have insurance. I mean, even if you don't have insurance, every dental office pretty much has some type of discount plan that you can join. Additionally, though they're just stuck on that. Oh my God, well, how much is my insurance going to pay? This is a true story. Now, if you do a crown and you have a PPO, let's call it out of pocket, it's going to be $400, $500. And they're looking at it going, well, no, my insurance should pay for it. That's not how the dental insurance is a help. Everybody equates it to the medical insurance. Oh, I know you're going to bill it like $10,000 and I'm going to end up paying $50. No, that's not how this goes, you know? And so education of patients with insurance is really, really important in order to get patients to say yes and get them into treatment and get them into health. So insurance is a problem that way. The second part of insurance is they continue to push down on the reimbursement, and it's reimbursement is going to be it's a fight. It's a fight that we all as dentists have to band together, group, private, anywhere. It's all our battle, and it's got to stop because premiums continue to go up. They continue to sit for 2 years. They didn't have to pay out. People didn't go to the dentist. They didn't go to healthcare providers. We still have people sitting on the sidelines, but they're still raking in that premium. Somewhere along the line, we have to increase reimbursement. If we don't, we're going to have to solve it ourselves. Because if you ask me, putting the soul back in business, where could it break? That's where it can break. It can break if insurances continue to decrease.
Yeah, the same argument's taking place now with all the transparency rules and pricing. The more people understand what's going on, the more they engage. Let's talk about technology. Is technology innovation moving forward in the world of dental practice?
We're in a boom. I mean, we're in a paradigm shift type of situation. I think I look back in 2040, I will say back in this time is the time that we did the paradigm shift of really in there. So we got AI moving in with, X-ray detection and so on and so forth, scanners coming into the offices, CBCTs, guided surgeries. It just goes on and on. It is awesome. It is a great place to be. It's fun to be in it at this point in time. And dentists are really good. I'll be honest with you. I think dentists are awesome at taking on technology and figuring out how we can move it through to help the patient and help our services better. The difference, again, too, in dentistry in 1980s, 90s compared to now is this. We used to be able to only take care of 10 patients a day. With new technology and the things that we have done, we are able to take care of double or triple the amount of patients per day. Not because we're doing bad dentistry or quicker dentistry or any of that stuff. It's because the technology has allowed us to do that, which is pretty cool. I think that's great. Our customer has changed quite a bit with technology, by the way, right? So a lot of people like to put it on physicians and healthcare and, oh my gosh, there's no more relationships and there's no more of this. By the way, us as, me as a patient, I'll call myself a patient now. When I'm a patient, I've created that issue. I've created, I want it now. I want it fast. I want it, all those things. So we're in a predicament where as a clinician, I'm like, okay, I got to form a relationship. I don't want to be too quick with them, but I want them out of the chair because they don't want to be in the chair too long. I got to sit here. I got to get them in when they want to, but they don't want to wait in the reception area. I got to get them into the back. Like it's a tough place to be right now because the consumer has changed, but the consumer still is demanding what you had in the past. I think technology is going to help bridge that gap together so patients can get what they want, continue the relationship, and continue to get quality.
Yeah, consumerism is going to grow in that area, no doubt about that. Well, AJ, this has been a real treat to learn more about what's taking place. I know that you've been very successful as a businessman as well as a practitioner in your dental support organization, and you're able to stick to your brand of keeping the soul alive, making sure that the patient is centered. I know it's been said of you like the Walt Disney approach to taking care of patients. Give them what they want and give them what they need. Be very patient-centered. So thank you for taking the time to be with us today on the Business of Healthcare podcast. And we'd like to have you back again in the future to catch up on this again and see what the trending direction, okay?
I'd love it. And thank you for all you guys are doing. I mean, like I said in the beginning, the more dentists can learn about business and the more that they can succeed in that, the better our field is going to be as we continue to move forward.
Thanks for listening to the Business of Healthcare podcast. To learn more about the Center for Healthcare Leadership and Management, go to jindal.utdallas.edu/healthcare.